Dr. David Minkoff, MD, graduated from the University of Wisconsin Medical School in 1974 and was elected to the Phi Beta Kappa of medical schools, the prestigious Alpha Omega Alpha Honor medical fraternity for very high academic achievement. He is board certified in pediatrics and has completed a fellowship in infectious diseases at the University of California, San Diego, which included research in developing new medicines to fight viral disease. As a clinical faculty member at the university, he also served as co-director of the Neonatal Intensive Care Unit at Palomar Medical Center. For 12 years, Dr. Minkoff worked in emergency medicine at the Community Hospital of Newport Richey, Florida, which ranks in the top 100 hospitals in the U.S. This emergency room has a chest pain center considered to be the top 1% of all such centers in the U.S. In addition to his traditional medical training, Dr. Minkoff has extensive postgraduate training in complementary and alternative medicine. He's an expert in functional medicine, chelation, allergy elimination, European biologic medicine, neurotherapy, longevity, aging medicine, endocrine therapy, oxidative medicine, and ozone, insulin potential therapy, and more. Whew, you are ultimate, man. You are the man. Okay, where was I? I just got blown away by that. Okay. Anyhow, Alternative Clinic in this country, 2000, he founded the Body Health and Nutrition Company, which offers a unique range of dietary supplements to the public and practitioners. He is also currently CEO of Home HealthWorks, an agency in which offers in-home care and which was founded by Dr. Minkoff's wife, Sue Minkoff, RM. Dr. Minkoff is passionate about fitness, and he's a 42-time Iron Triathlon finisher. Woo! I compete in the World Barbecue Association. Anyhow, so having also qualified 8 times for the Kona World Championship, he also devotes time to writing, research, and he writes 2 online letters each week, the Optimal Health Report and the Body Health Fitness newsletter. Ladies and gentlemen, the one and only Dr. Minkoff.
Thank you, Phil.
Thank you.
Hi. Are you awake? Do we need some calisthenics to get things going? All right, stand up. All right. This is an alteration of a Zach Bush idea. Put your hands out front. Now inhale as you pull your hands back. And now reach down as low as you can. If you can touch the floor, touch the floor. Exhale. Now stand up while you inhale. Okay, so in, exhale, up, in, exhale, up, in, exhale, up. One more. In, exhale, up. Okay, now, one arm up, one arm down. Down, 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 down. Do 10, 6, 7, 8, 9, 10. Okay, now we're going to go this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now push 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let your hands drop, close your eyes. Feel the nitric oxide perfusing your body. Okay, have a seat. So the topic is age reversal versus anti-aging. Anti-aging sounds good, but age reversal sounds better. You know, in the old days, nothing was really explainable because there really wasn't any science. And people sort of had faith, or they went on their perceptions, and that was their truth. Nowadays, the card is flipped completely upside down, where the only thing is we have science and we have models and we have anatomy, and that's how things are. And the idea of some kind of ethereal force that can affect us or alter us is pretty much gone. And the other thing that's happened nowadays is now that the science isn't even science anymore. It's propaganda. And so now, I think it opens a door to looking at things in a different way. Now, I think about this, and when I went to school, the neurology model said that a nerve conducts at 11 feet per second. And if you put an impulse in someone's toe, and they're 5'5", that it would be a half a second up to the brain, and it would be a half a second back. And if you're walking along, and you hit something, if it really took a half a second up and a half a second back, you'd be on your face every time. And so our neurology isn't what the books say. It's this very integrated system with trillions of connections that are speed of light. They're speed of light. It's almost instantaneous. How does a guy hit a 104-mile-an-hour fastball? There's no time in that at all. There's no time. And so I think what I want to talk to you about today, I think is going to test this model of, are things working the way we think they are? And is there a great big wide open door that we can walk through, or we can really learn from each other to improve our health and our lives and all that stuff? Now, I like to read science fiction, and one of my favorite series is called Old Doc Methuselah. And Old Doc Methuselah was the doctor for the pilot jockeys in the year 3000. And he had a very interesting machine where he could put a space jockey in there who'd lost an arm or gotten some kind of laser tap on his body. And he could put the space jockey in there and send some photons through the guy, and he would come out the other side, and he was fine. And I found that to be, that's an inspiring thing. Now, I want to thank Joe Mercola because I ran into him last May. We were both at the Bulletproof Conference. And we got to talking, and he looked awfully good. And I said, Joe, what are you doing? And he said, well, there's this stuff called VSELs. And there's this guy out in California. And you ought to go meet him. And then he showed the video today of that press of 600. But he had a video that he showed us then of him deadlifting 400 pounds 5 times. And at 67 years old, that's the most he'd ever lifted. And that's pretty remarkable. That you could get better while you age. And so that inspires me. So my wife and I in August went out to find this guy, Dr. Todd Ovakadis. I'll give you his contact afterwards. And we said we need to know about VSELs. And we went in there. I had a 9:30 appointment, and she had a 10:30 appointment. And we were supposed to be out of there by noon. But when he started to talk to us about the technology that he's invented and how it works, my wife and I were both pretty much mesmerized. And he liked us because we were so interested, and we have a clinic, and we're into all this stuff. And basically, he canceled his whole afternoon appointments, and we sat with him till almost 6 o'clock that night and learned about this technology. And then it took me 5 months to convince him that I wanted to do this in my clinic because I thought it was the most amazing thing I'd ever seen. And finally, he consented, and so we have about 6 months' experience with this, and I'm going to talk to you about it now. Now, it has a technical name, and I'm not going to make you crazy trying to figure out what this means. Just concentrate on nano for a second, and nano is pretty interesting. A nanomolecule is only 3 atoms long, so it's very small. And nanotechnology, when we talk about light and about the universe, nanotechnology is like, that's where it's at. You know, in the beginning of the universe, the original particle, you know, if you go back to the Old Testament, it was let there be light, okay? And when there was light, there was distance, there was separation. You know, there was consciousness, and then there were other things. And so the basis of all pretty much structure in the universe really comes back to light. So the visible light band is here. You've seen this a couple times today. Ultraviolet on one side, infrared on the other side. So what this guy did, this scientist, is if you look at the second definition, bioelectric, so it's passing electromagnetic waves of laser light through biological tissue, you can influence the molecules in that. And we all know that. You stand in front of a red light and you feel that something occurs in your mitochondria and you feel better, or you get some energy, or you get a detox effect. Now, if you alter the laser beam, and I'll show you how this works in a minute, you can put laser beams not just lined up in this normal way, but you can pair laser beams so that they're opposing each other, and they don't have the characteristics of light at that point. They have the characteristics of sound, so it's photoacoustic. So there is a dead point in the cycle. It's a pulsating cycle. Now, lasers don't go very deep. A red laser only goes a few millimeters into the body. If you can alter the phase of that laser beam, split the beam, alter the phase, line them up so now it's pulsating, and then put those beams through a holistic hologram, you can dial in the resonance frequencies of living cells and portions of living cells, and especially the DNA. Now, these beams, when they're coming, aren't two-dimensional, they're three-dimensional. They're cycles, they're spirals, and they look very much like our own DNA. And so you can modulate that frequency with the right holographic image so that you can influence DNA. And our DNA is a light-emitting molecule anyway. It's a pulsating photon generator. That's how the communication happens. And this is some artist's rendition of what it actually looks like. It's light. Now, a very interesting study was done using this particular laser, where random precursor cells were put in a suspension. And what happened was, this laser was applied to it for 5, 10, 15, 30, or 60 minutes. So the laser beam goes all the way through. The next day, what they found is that the stem cells lined up. That they were able to turn on adhesion factors in those cells, and they weren't lined up on the bottom, they're lined up in suspension where the beam was. And that these molecules were biologically sensitive to information coming from this specialized laser. Now, if we look at applying this towards stem cells are supposed to be able to replicate themselves. There is a class of stem cells that occur as soon as conception occurs, but these cells, through the cycle of genesis of the infant and at birth and up to now, have never actually been started. They're still in a fetal state. Their telomeres are full length. All of us have them. They're called V cells. Get you in a second. And these V cells are sensitive to this laser to the point where they can get turned on. And so V cell stands for very small embryonic-like cell. Now they're not embryonic because if you alter embryonic cells, you can end up with teratomas. But these cells are pluripotential. They can become any of the 3 germ cell layers. And they're responsive to laser in that they will take direction. And we all have them. Now you could get stem cells from another person, not as desirable. You could take stem cells from your person, but my bone marrow cells and my fat cells, they're too old. And while they can work and some people get good results from them, it isn't optimum. So what we want to do is reverse degenerative disease. We want to repair trauma. We want to improve the condition of tissue. We all want an anti-aging effect. The other challenge with stem cell therapy is trying to get them to the right place. Because unless you put the stem cell in the knee or the shoulder where you want it, if you're putting it in the venous side, they're not going to go very far. The average mesenchymal stem cell is between 12 and 30 microns. What's the size of an average lung capillary? About 6 microns. So if you're putting it intravenously, it's going to go to the right side of the heart and to the pulmonary circulation, and 99% of them are going to get stuck in the pulmonary circulation because they're just too big. If you have COPD or lung disease, it could really help you. But if you're trying to get it someplace else, it just is not the smoothest way to get there, and it's not so effective. So if we were able to use laser guidance for these cells so that we could send them where we want them, we could first activate them and then send them where we want them, we might have a better model. So your typical stem cell takes 3 to 6 weeks to observe results. I've had multiple various exosome treatments and stem cell treatments, and I really couldn't tell you for sure if I ever thought anything actually happened. And I have a very good friend who has a big stem cell clinic. He works out of Los Angeles, and he confidentially tells me the same thing. So the difference between this and laser activated is that you may see clinical improvement within 45 minutes to a couple of hours, even though a person may have had an anatomical demonstrable lesion for years and years and years. So this is a proprietary laser system. I don't pretend to exactly understand how it works, but it's very interesting to see how the thing goes. And when you do the treatment and you have your blood drawn, and then with a special centrifuge, these V cells are separated out, the practitioner will then hand you the vial, and you do kind of a where do you feel it type exercise. And normally it's like, well, I feel it maybe here. Okay? These cells are then lasered for about 15 minutes with this laser in the test tube. And then you're handed back the test tube, and you're asked, where do you feel them now? Oh, I feel them out here. You can actually feel the pushback. And we've done this on about 50 or 60 people so far, and virtually everyone has the same experience. Like something gets ignited, some energy gets ignited in these cells, and they are on. And they're on, ready to replicate, and they're also develop these adhesion factors so they can stay where you want them to go. Now, the person, usually based on their history, is asked to say, like, what areas do you want to work on the most? There's kind of a general one where you do brain organs and thyroid and adrenals and ovaries or testicles. Some people, like with the long COVID, they have pulmonary disease where you concentrate on the lungs. And if the cells are lasered, and then injected IV. And as they're being injected IV, this laser is concentrated for about 5 minutes per area over those areas. By golly, those cells go there, and they stick there. And then the effectiveness of the treatment is way increased over whatever randomly would happen. Now, this was a study using, this is a meta-analysis of 1,494 patients who got stem cells injected directly into the coronary arteries. And there was only a 2.5% increase in ejection fraction over 180 days. It didn't work. Like, you could put them in the heart, but it didn't have an effect on healing the heart disease. Now, with laser-guided stem cells, so the cells are lasered, they're turned on. Then the heart in 2-dimension is lasered, one from the front and then from the side. And then the cells are injected. So this was a study where these were given IV to 10 patients who were on transplant lists for heart failure, low ejection fractions. And they saw a 3% increase in ejection fraction in only 3 days. That was statistically significant. And a 14% improvement in ejection fraction by the end. And at each point, this is one treatment. So these were all end-stage candidates for heart transplant or ventricular assist device. Improvement statistically significant for every measure that they did from day 3 to 90. There was a 50% average increase in heart function. This is one treatment. 50% of the patients improved off the heart transplant list, and 20% of the persons improved to nearly normal with a single treatment. And this has been the fastest and best stem cell results that anybody's seen for severe heart failure. And this is published work. So this uses the person's blood. It creates stem cells that appear to have the biological potency of newborn cells. And there's nothing added to it. There's nothing done to the cells at all. There's like 5 publications last year and 5 publications this year on this technique and on this laser. And these are on the slides if you want to look at it. So the process separates and purifies and activates these very small embryonic-like stem cells. They're pluripotential. They're very small. They can traverse the pulmonary circulation and thus distribute widely through tissue, even brain and spinal cord or gonadal tissue. They have the telomere length of new cells. And they've measured the Hayflick limit on these cells. So an average, one of our average cells has a Hayflick limit of about 60 divisions. And these cells have been tested, and they have a Hayflick limit that's over 200. So they really are regenerative new cells. So here's a couple of cases. Middle-aged male, diabetes, had a stroke 6 years before, claw right hand, densely numb right arm, had a fixed lesion. Also had a T4 spinal injury 30 years before, no change since then, had pain and spasm over that area. Within 1 hour of treatment, the movement of fingers with return of sensation of his right hand. So that's what I'm talking about, though. The models that we have, if our technology is really good, don't work. Like the model doesn't work. This guy's got a fixed lesion for 6 years. And within an hour of treatment, he's getting sensation returned to his hand, and within 2 hours, he's playing the piano. After 24 hours, nearly full function of the right hand and arm, with spinal sensory level improved 3 to 5 centimeters front and back. Painful muscle spasm much reduced within the first 24 hours. After 6 weeks, spinal sensory level remarkably improved to the low back. So that's pretty exciting. Here's another one. This is an MS case. This one I have on some video, so I'll show it to you. So this guy was police chief in Tijuana. And he did a really good job with the drug guys, and so they gave him a promotion and they moved him to Juarez. And the gang found him and he was shot 5 times in the chest, left for dead. And he had a T5 and below, no motor, no sensory. And his first treatment was about 7 months after that injury. After 10 days, a persistent non-healing sacral ulcer of 3 months duration, completely healed within 10 days of treatment. At 6 weeks, he noted return of partial erectile function. Over 6 weeks, spinal T5 sensory level improved 15 centimeters down the front of his chest and back. During the second treatment, 6 weeks after the first, he felt sensation in his abdomen and legs, felt needle enter his right foot. 2 weeks later, he began to wiggle his toes with plantar stimulation. Go ahead.
So we're here with Julian Leizaola. We did a laser-guided stem cell treatment in early December, and now it is January 21st of the following year, 2016. And the treatment was for an upper thoracic spinal injury, roughly the T5 level. And we've had some very encouraging signs. So would you like to say what you have observed?
Lo que siento, or in English?
In English, if you can.
Okay. What I feel?
Yes.
Okay. Starting for my head to down. First, in the lesion area around my body, I feel hypersensibility.
Yes.
Too high.
Yes.
It's maybe it's dolorosa.
Very painful.
Painful
Yes.
sometimes. And in my back, I have electrical shocks. I feel.
Yes.
And
And
in
this
my
was
body-
this was below the level of injury, so it's the sensation coming back
Yes.
where you didn't have sensation before.
Yes, in my back and in my abdomen.
Yes.
Ajá.
Excellent.
In my, ¿cómo se dice? Pompas, sentaderas.
Buttocks.
Buttocks. Nice.
Ajá. I feel burning
Mm-hmm.
and I feel sleep.
Yes.
Numbness.
And in my legs, I feel electrical shocks in all my legs,
Excellent.
all around, and then my feet in my heel,
Heels.
I feel burning and electrical shock too, and then my pennies I feel electrical shocks.
Yes.
And one says sensations to keep up
To get
in
an
2
erection.
times in the
in the noche.
in the morning.
In the morning.
I have one erection
Excellent.
too high
Too high. Too much.
2 times.
2 times.
Uh-huh.
So we're here with Julian.
I'm going to skip the next one. So he had another treatment after 6 weeks.
My sister and I.
Tell them.
And then about 11 months after the third shot or IV treatment, here he is. Go ahead and play that video. He's walking and he can ride a bike. This is a fixed T5 and below complete lesion. You get the idea. Okay. Now, here's a gal, 16 years, macular degeneration, getting Avastin injections every 3 months in her eye. This is 45 minutes after her first treatment. Go ahead, play this one.
I have macular degeneration, and I really see almost nothing centrally from my left eye. With my right eye, I was able to see, if you envision a clock, I could see from 9 to 12 on that clock, but only with layers of screen in between. So it was foggy-ish, cloudy-ish, but I could still tell somebody had an eye, for example, whereas otherwise I couldn't see any features on their face whatsoever. And when I did the chart, the only thing I could make out were the top two bars on the large E. And now, I not only see the E, but I can tell the letters below it, the F, and I also saw a T below that and another letter with that line and the L in the letter below, the line below that.
From the top line only, basically, to 4 lines down the chart.
And
it's
that's
45
within
minutes
how many minutes?
post-procedure.
Yeah.
Is that about the time? 45 minutes
Yes,
afterwards?
I
Now?
think so.
So I'm really,
And what about your peripheral vision?
oh, my peripheral vision, because not only can I see them, but they're clearer. I don't have the screens in between that were making it foggy and cloudy, and I can see. I mean, if I look on the second line where there's the F and the P, if I look equidistant to the right of the P, that F and P are just like crystal clear.
Amazing.
Yeah.
Yeah.
So I don't know. I mean, I do know. Like you said.
Awesome. Thanks for sharing that.
Thank
I'm
you.
really happy for you.
I have macular degeneration.
So this guy was a high-level athletic trainer in Thailand, spinal injury on a motorcycle, 17 years before, chronic severe low back pain, and here's his.
We're here with Stefan, day 3 post-procedure. He's
Great
looking,
to see you too.
yeah, he's looking very bold and good today. So if you'd like to tell us what you've noticed since you had the procedure a few days ago.
After the last turn. So the first is when we make this last week, started really soon when you put the plasma back into my, or the stem cells back, embryonal stem cells back into my blood, and you started with the laser on the back, started the pain in my lower back, so where is the crash going on, is going down after 2 minutes nearly to nothing, to zero.
In 2 minutes?
After you know, you made the first time with the laser was 5 minutes. You remember you started
yes.
with 5 minutes. After 2 minutes, you remember when you say to me, "Hey Stefan, why you move so far with the black to the left, to right?" And then I told you, I watch for my pain point, but I cannot more find them. I cannot more find the pain point. So and this is now to this moment. After 1 week, is now to this moment. So it has not changed anything.
We're here with Stefan, day 3 post-procedure. He's
Great
looking,
to see you too.
yeah, he's looking very bold and good today. So
Okay, do this one.
The second is, I think this started around 90 minutes after when we finished our session here, is the pain in the shoulders going really down. The pain in the shoulders really down. And this is the first time more as after 5-6 years, I have so less pain as now in my shoulders. The second is, I think this started.
Oops.
Also, was this the first time in the last week, in the first night, not sure it's coming, but it's so much in my body, but it's the first night I sleep after my accident completely the whole night.
great.
Yeah.
So this is another case coming up. This guy's a Harvard research neuroscientist. Was diving at 200 feet, got an air embolus in his spinal artery, got pulled up, got CPR, survived, has had a fixed neurologic deficit for 35 years, and here's him.
Pardon?
And give the date.
So the thing that most amazed me was that I had this long-term, like 35-year injury, and within hours I was seeing changes in sensation. I mean, that's just not accountable in the neurological model we have now. I mean, like I had this neurogenic numbness in my left buttock and all the way down my whole left leg, which is, it's I could touch, I could feel, but it was like just the same feeling no matter what you did, when you pinpricked it or pinched it or touched it or hot or cold, it all felt exactly the same. And I'd accommodated to that. And so I went down, I'd been after received the stem cells, but a couple of hours later, I touched my, so I thought, well, wait, that feels like a touch.
Mm-hmm.
And then I pinched myself. I said, that's a pinch, and it feels exactly like this pinch over here. So within 3 hours, this neurogenic numbness that had been there for 35 years just began to disappear.
Play this one then.
So that was the first observation. And then over the next few weeks, I began to notice a sense of touch returning to the palm of the surface of my hands. So since my accident, I had absolutely no sensation on the palm surfaces. And so I had to adapt to that because it was very difficult to try to pick things. So I'd go to a desk and grab a pen. I get over to write, the pen is in my hand, the pen's still on the desk. But I couldn't tell because it felt like I had done the action, but I couldn't tell whether there was anything there or not. I couldn't use paper cups because I'd either crush them or drop them on the floor. I couldn't tell how hard, and glass is something I could squeeze hard enough to get the mechanical sensation. But other than that, I couldn't use that. And those are then I began to get at first just general kind of sensation with my hand. So up that time, if I had things in my pocket, and I wanted to get my keys out, I wanted to get the change out, and there's something else in my pocket, I just had to take everything out of my pocket and put it down, and then I could see the thing that I wanted to pick up, and that's how it had been. And so, but then I could start to actually, hey, well, this is actually keys, and this is a coin, and so it's actually beginning to get differentiation back, and so then that became progressively greater and greater and greater. So now it's probably 90% of my touch is back. So one of my big challenges is buttoning a shirt, because unless I could see it, I couldn't possibly button it. And so now I can feel that's a button. That's the button. So I can actually, just by touching it, I know what it is and kind of how it's oriented. So that's been a huge change, and it's gotten better and better and better. It's probably 90% now. First it was only about 30. At the first month or so, it was only 30%. But then it progressively has come back, and that may be nerve growth, because it came back, and over a period of time it would be representative of nerve growth.
Right.
So that was the first observation. And then...
Okay, now here's some Parkinson's cases. So again, if you're gonna get the cells to go to the substantia nigra, you hit it from 3 directions, 5 minutes, 5 minutes, 5 minutes. So moderately severe Parkinson's baseline, and then 1 day after a second treatment, 10 weeks later. So play the left side first. This is him pre-treatment. And then show the second one. Not bad, huh? He looks like a new guy. Then, yeah, play that one. And then second one. Look at his face. Incredible. Then this one. Good. And then here's walking. Pre-treatment. Second one.
Right there. Turn around.
Wow.
Nice arm swing. Wonderful.
And he's dancing with the doctor. Two treatments, 10 weeks apart. Now this is 30 minutes after a treatment. So do the left one.
Go like that, from one to the other. Good, fast as you can. On the other side, way faster than before.
Yeah.
Just look at his face in both of them.
Good.
Don't have to concentrate as much.
No, this is why. Go like that. From one. Start the right hand.
And then here walking,
Before, very good.
or trying to hold balance.
Wow. Keep
Good.
going.
And Olivia, that's fantastic. Before, very good.
30 minutes after the treatment.
Wow, that's fantastic.
Now this guy also had severe arthritis and he needed a knee replacement. And then 30 minutes after the treatment, this is his son talking.
30 minutes post-procedure.
And we discovered another result of the treatments, and that is that my dad did not have any pain in his knees standing up, which was before the treatment a 10 out of 10 on a pain scale. So that's
Quite dramatic, yes.
That's a significant result.
10 to 0. It's impressive.
Yeah.
Great. How are you feeling?
Wait, it hasn't sunk in yet.
Yeah.
I think that is so much better.
Yes, it's amazing. It's very
Yeah,
good, isn't
yeah,
it? Yeah,
it
fantastic.
is, yes.
Great. Well, we're very pleased. So, how do your knees feel now?
Fine.
Fine. Fantastic. So good.
Okay, so each condition is treated clinically. These cells can be put, you can do facials with them, you can put them in different joints, in addition to the IVs. It's not known exactly how frequent you can do them or what the effectiveness is. I've decided I was going to do a treatment every 3 months. And yesterday, Ryan Smith presented the data on TrueAge. And oh, wait, here's one more. Let me just show this one. This is a pre and post systemic treatment, but look what happened to her hip.
Reduction of internal and external rotation. So
Straight leg raise.
Significantly less range on the affected right side.
Okay. And they will go in.
It's much more inward range than before.
Yeah. How about out?
And external rotation.
It's a very different. Now it feels like a sore muscle, but there's
Yeah,
no
that is-
pain.
Yeah.
We'll see how far it will go. Oh, that's pretty good.
Less range.
Oh my gosh. Okay.
Jeetje.
Wow. Okay. It was so.
Yeah.
Let's skip this guy. Here's a hair regeneration. That's a before and an after. Here's another hair. So I think the exciting part of it, I wanted to just tell you, on this true diagnostic. So on average, the patients that have gotten this treatment have shown a 3-year decrease in methylation for age. I've had 3 of the treatments, and I've had a 12-year reduction in true age over 9 months. So I think that I don't have enough patients yet that we've done this on for me to be able to tell this, but Dr. Obakadis has done lots and hundreds of patients, and that's what that's what has been showing. So that's pretty exciting. That's really age regression. That's what we want. So this is Dr. Todd. I think the exciting thing about this is this has just opened up a new horizon for treatments that are coming, and they have to do with light, and that the future is just really bright. He was very excited about all the adjunct things that we could do with patients, all the ozone treatments and the pulse magnetic field and hyperbaric oxygen and all this stuff as adjuncts to this could really, I'm not sure if there's a, what the new limit is. And I find that that's really exciting. It's just opens up the doors. So, it's interesting in the Bible, at the creation story, Genesis 1:3, the world got created with the words, "Let there be light." And then a few thousand years later, the second Bible is, "In the beginning was the Word," which is sound. So in this thing, we've got a combination of light, and then you turn this light into a pulsating photoacoustic wave, and now you have sound. And it's just like there's an infinite potential for these bodies, and I think that the model that we've been working on is very antiquated. And that if we start thinking this way, then people are going to develop more new stuff, and maybe we'll arrive, hopefully before the year of 3000, where old Doc Methuselah had a machine where you could just fix people. So now I spoke to Dr. Mercola beforehand, and he said that he would reprimand me if I didn't say a few words about EBOO. So how many of you guys have EBOOs? Okay. So we got our EBOO from Anna. She's here. And I think we were the 5th or 6th one in the United States. And she came and trained us. And, it's a remarkable treatment. And if you do EBOO before and then stem cells after, you get an even better result. One of the things in doing ozone, so I learned ozone from Dr. Frank, I think in 2010. And we've been doing, I estimate we've done probably over 60,000 IV ozone treatments in that period of time. And I never had a way, the patient would sort of tell you, I'm getting better, it's working. I knew that once I learned ozone, it was the most effective thing I'd ever seen for anything. It was just a universal antidote. And so we did it for everything. One of the interesting parts about EBOO is that you can get an idea of just how bad they are because the EBOO has sort of an outlet system or a runoff system where the toxins collect in like a beaker as you go. And so the treatment is about an hour. The blood cycles through this dialysis machine. It's exposed to very high concentrations of oxygen with ozone. And the filtration system seems to siphon off different kinds of toxins. And so a very sick person, you might get 2 liters of toxins after the first treatment. And maybe by treatment number 10, they have less than 200. So our standard is if you have less than 200, you're in good shape. So I try to do one about once a month. Mine run just right under 200. So I know I'm pretty clean. But the sick ones are sick because they're really dirty. They're dirty with toxins and metals and, infectious residues. And the EBOO seems to be a very good gauge of where they are. If they've done 20 EBOOs and they still have 700 cc's of residual, you know, that person is a really toxic person, and they, you know, they just need to keep going on the treatment so they can clean out, you know, on sort of a gradient level. Their cells are toxic, and then their interstitial fluid, you know, the cells dump to the interstitial fluid if the interstitial fluid is clean, and then it goes to the blood if the blood is clean, and if the liver can handle it and the kidney can handle it, it can get out. And I think we just work our way through these layers, and we see some quite remarkable results with people in terms of improvement of healing, clearing of brain fog, and especially mitochondria and energy. Because that intracellular toxin load is in the mitochondria, and that's why they're sick, and that's why it doesn't work. And we have Frank's bioenergy machine. If you don't have that machine, you should get that machine too. Because you can document, like, where are they when they start? You know, what is their overall health assessment? How well do they utilize oxygen? And if they're utilizing oxygen at a very poor rate, it's going to be a long haul with these people because they're really toxic. So anyway, that's, I think there's some time for questions if anyone has any questions. Yeah. He charges 10, we charge 7. It's not bad. Yeah, the laser is the scarce point on this is the laser. The lasers are very technical in the manufacturing, and I need a second one because we're pretty busy with it, and I'm on a waiting list. So that's the holdup. And I think that if you guys are interested and you email him and tell him you were here and you heard me talk, that he wants this to be, you know, he wants this to be very broadly deliverable because it's so fantastic. Yeah. It's a low level. I mean, the laser comes already made, and it's got this thing that'll split it, and it's got this holographic image. It's only a 1 milliwatt 670 laser. This thing where the cells get turned on is really an experience. You know, like the person comes in and I don't know if I feel anything, but then when they get the cells lasered, they feel it, and they feel it like a couple feet. You know, like something, you know, I feel like there's sort of an ethereal aspect to this thing. You get fixed nerve lesions for 35 years, and then you get repair in the matter of days or weeks. That anatomical lesion wasn't completely fixed. Like you were doing something to alter the structure and function of that tissue almost magically. Yeah.
What is the cost of setting, the whole thing up in an office, the laser, I guess centrifuge, whatever?
It isn't expensive. I think if he has them available, then he'll go into his mind. I'm not here to sell these things for him. I just said, I'm coming to this thing, and I think I'm very excited about this, and, you know, is it okay with you if I present it to folks, because they're gonna like this stuff. These people are gonna like this stuff. And then, you know, if like it took me 5 months to get his approval. It was, you know, he wants this to be in the right hands. Yeah. I don't know about his case because he's been doing this for quite a few years. My best case, I had an effect that I wasn't expecting. I put on, I do Ironman triathlons, and I have a workout routine that I've been doing for years, and it really hasn't changed. 3 days a week I ride, and 3 days a week I swim, and 3 days a week I run, and 3 days a week I do sort of a yoga strength stretch routine. And between August and December, I put on 9 pounds of lean muscle mass. That was sort of like unexpected. I hadn't changed how much perfect amino I'm taking. I hadn't really changed the routine. I wasn't lifting weights differently. but my body muscled in a way that was very different. And it wasn't even sort of on my list, but that was one of the things that I noticed, like, wow, that's really good. And then I'd had a really bad case of COVID right before we got the treatment. I mean, I was out for a week. I'm never out. And I knew I wasn't going to die, but my wife didn't think I looked very good. And I think I got a very fast recovery, so that within probably 6 weeks, I did a sprint triathlon. I won my age group, and I actually was like doing really good. And the other thing that happened to me is after COVID, my PO2 is running 95, 96. And after the treatment, now it's running 98, 99. And I didn't really have much pulmonary symptoms when I had COVID. I wasn't short of breath. I had a little bit of cough, but it was dry cough. But there's a definite healing factor in my body that changed. And the other thing that was interesting is after the first treatment, Sue and I are looking at each other, and we actually thought we'd just been injected with some wonderful drug, like some endorphin-releasing, incredible drug, which lasted about 3 days. It was kind of like, everything is just too bright, too beautiful. What happened to my brain? And that was worth it just for that. Yeah. I just don't think there's any limit. I think this is an adjunct treatment because you all have other stuff that you're doing. And what we do is we just do this with everything else at the same time. Because this doesn't contraindicate anything that you're doing. And, it's an inflammatory condition. It's an autoimmune condition. And, we find with our ozone and all the rest of this stuff that a lot of people with these autoimmune arthritic type things, that we get big improvements with them. And most of them have Lyme, so treat their Lyme, that they get better. And this really could get better. We had another patient, ALS patient, came from a foreign country. She's 42, disaster, had to be on BiPAP continuously. And we did a treatment on her, and she was able to be comfortable and not short of breath with just using her BiPAP as an assist, not as a constant breather. And she was very excited about the change in her. And if you have ALS cases, they're terrible. They virtually all die. She's a year. She's still going. She's not great, but she's better. She has a family. So I want to do more of these on her. Anybody else? Yeah. Is Anna here? I'm sorry, Angie. Ask Angie. Raise your hand, Angie. Angie is amazing. She will come to your office. She will teach you how to do it. She will walk you through it. She'll train your nurse or your other practitioner. She's here. She's an EBU success story. She herself has done over 900 EBU treatments on people in her own practice. And she's just a wealth of knowledge, and our people feel very comfortable delivering it with her training. Yeah. Yeah.
Where are you located at?
Clearwater, Florida.
Dr. Todd?
Dr. Todd is in Carlsbad, California. All good? Okay. Thank you.